Good morning to everybody online. We are just allowing all of the participants to join, come through to the lobby. We will start around 9:05. Good morning, everybody. I trust everybody's keeping well. Ntokozo, can you just confirm that you can hear me?
Loud and clear. Thanks, Christina.
Great, thanks very much. Um, for today's session, we just quickly want to take you through the startup of the variation submissions, renewal submissions on the SAHPRA engagement portal as of Monday. There are some, I think, nuances in terms of the ECTD 3.1 specifications that we need to just stress with everybody again, as one of the issues that we've picked up during testing is that there seems to be confusion around how the ECTD 3.1 submissions work, and obviously the engagement portal being designed to support submissions for 3.1 specification had caused some misunderstanding and challenges. So we needed to just make sure that we are all in lockstep on that. So for today, as we've just got an hour, we will be running through the presentation, just sharing some pertinent information with you. And I will also be asking Madeleine just to touch briefly on the topic of content reuse from an ECTD perspective, just so that we can explain how the submissions that need to come in for the same codes, but being routed then to different work streams, for example, to quality and to inspectorate, how that submission or the submission folder can actually be set up so that you can use the content reuse functionality, which was then enabled when we went live with 3.1. But I think, yeah, let me then start and take us through. Madeleine, if you can move through to just the agenda so we can just talk a little bit about what we're going to cover. So I just want to again touch on where we are with the legacy data updates and what is going to change then as of effectively this afternoon when we do the cutoff and we go into the freeze period for the data synchronization then that starts tomorrow, Saturday, Sunday. We will be looking a little bit at the variations code reference table. So I can just show you what that looks like. That also will be published after the webinar on the webinar link so that you've got that reference table. Obviously, that will also be part of the updated variations guideline that will be published in July. And then just again, reflecting on how things work and how our submissions are supposed to be put together in line with the submission matrix for 3.1. So how variations are submitted, how many changes, i.e. the codes or evaluation requests can be submitted under one variation type per submission, process to follow for Z code change requests, for related changes, and then also the process to follow for requesting a correction to the variation code reference table if there are new codes or there's additions or there's something missing and so forth. Thanks, Madeleine. Just the next one. So I think first thing that we wanted to cover is just with the legacy data, we enabled the export import tool to allow the correction or the completion of some of the legacy data sets that we've got for the applications. And this is just obviously for all of the application submissions that we received prior to us starting to use DocuBridge and starting to use a trigger file. A lot of those legacy applications came in sans a lot of this information, this metadata that we now use within the DocuBridge environment. So we've gone through that process now since the start of April to bring all of those metadata fields up to date. And where we are then today is also gearing up for the resynchronization of the DocuBridge database with the portal database, making sure then that the relevant application ID attributes are synchronized between the two systems, and therefore there are certain fields which at the moment was updatable. But if those fields are affecting the trigger file, meaning it's a item that we are keeping in DocuBridge to help us with classification of the regulatory document systems, those are now going to be locked for further editing, as of this afternoon. So when we start the data synchronization, the export import tool will also then be updated. So as of Monday, certain information can still be updated via the export import tool, but anything that you use to fill in for the trigger file, those very specific metadata fields will now be grayed out. They will no longer be updatable. So I trust that everybody has had a chance now over the last 2.5 months to complete all of the legacy data updates. Any further changes then will need to follow a process whereby a request then gets sent through to the ECT dot validations at sahpra.org.za email address. And then I think the main thing also is just to make sure that we, for today, as per the communication we shared out, we just try and get all of those submissions in before 4 o'clock on the SFTP manual submission process. Applications then that are submitted after 4 o'clock, we actually will need to purge those off the system, and those then can be resubmitted through the portal from the 23rd of June. So please try and get those in before 4. Otherwise, yeah, unfortunately, we are going to have to clear them off. And then the items that came in before 4, we can still process. Um, so data synchronization, we have received quite a number of queries where applicants were also asking, well, when is the information going to be updated? So that also then, as per the communication, this is what we are focusing on from the 20th, 21st, and the 22nd, is to just update those databases. Now, one of the things that I do just want to point out, it's already in the pre-work that we've done. We've seen some very strange values that have been updated on the data tables again with the export import tool. And this, I think, because those inputs are now coming directly from applicants, we have taken that information in. But it is a bit of a concern because we can see that there is again misalignment and incorrect data, incorrect INNs that have been populated and filled in, and it's proving quite a challenging thing for us to get the data standardization and the controlled vocabulary aspects properly controlled and locked in. We are going to have to reassess then the manual override function, as it seems that we will have a continuous problem with incorrect information that gets input. Over the next few days, we will try and see how much of that data can then be properly aligned. And you will need to check again on Monday that the right information is sitting in the right data field and that we have got then complete and accurate information as it should be for your applications once we have resynchronized the two databases. As I said, some of the fields you would still be able to correct through the export and import function. But when it is a trigger file related information item, like for instance with the INN, that will need to follow then a request process whereby those requests can be emailed through to the ectd.validations@sahpra.org.za. And those, again, because now we at a different administrative process, those will take 10 business days to turn around. So I'm hoping and I'm trusting that we've made a really good effort to get us good, clean, quality data through this process that we've been busy with now for the last month and a half, if not longer. But then again, as I said, if there are still then remaining issues or problems that have been caused with incorrect info going into the wrong spaces, these will then need to follow a process of requesting now manual correction, which is a longer process for us to turn around. Madeleine, if we can then also just, before we go to the next slide, sorry, just the last topic that I wanted to reflect on is um, I also at this stage just want to make sure that we have an understanding around adding the information line on the portal through the export import tool, that the actual ECTD submission has been submitted through the SFTP process. And this is quite critical to understand when you check on Monday. If that ECTD folder had not been submitted through the FTP process, from a DocuBridge perspective, that actual document, that actual submission is still then not in the database, which means that, it's almost like that we're going to reset that value. So I am hoping that everybody's done what they were supposed to do, and all of those missing sequences have now been submitted through the FTP process, and that at the same time then we have also just reflected that on the export import tool, so that it's easy for us then to build the linkages, and that everything document wise that's in DocuBridge actually then corresponds to a line entry that's on the portal. Thanks, Madeleine. Next slide, please. Right, so I think the variations code reference table, so this is just an extract or an excerpt of what this basically looks like. We have accommodated and obviously taken a lot of the feedback that's come through from some of the portal queries, some of the discussions we've had with folks that have been part of the testing group. So onboarding then on the code list, some of the codes that were not there with the first version, things that we had been asked for is just to make sure all of the biological codes with that particular prefix of the Q is brought in. But it's important for us to also note that these prefixes and suffixes over time will be phased out, because the product category being a biological product, if there is a quality change, it's a quality variations code that is applied, and then based on the nature of the product, whether it's human orthodox medicine or it's a biological product or it's for argument's sake, a veterinary product in future, the product type will then determine also which internal work routing process it goes through. But the code, as you can see here on the screen, on the left-hand side, as the example is B.1.B.1.A, that is your variation code. You'll see that there is 2 line entries that we've got on our variations table. You will see that right next to it, we reflect this code could be either a 1AIN based on the risk, and if whether or not you meet the requirements and the criteria by the unit. If you do not meet the requirements and the criteria, obviously that gets upgraded from a risk profile perspective to a 1B, and the different timelines then that apply for these 2 different variation types. So when you do your submission on the portal, you would know whether or not you meet the requirements based on the technical unit guidelines. And then when you start your process, the first thing you do is you will indicate which variation type you're submitting for. If you don't meet the requirements, you know you are going to submit as a 1B. And as you then select the 1B and you go to the second screen where you actually have to then pick the specific variation code, you will find code number B.1.B.1.A and select that for then the 1B, and then proceed with creating your sequence and doing your submission. For some of the codes that's in this reference table, which we will share for clinical specifically, you will note a suffix S, and also when you select those in the variations portal drop-down list, they also will display with an S. And the reason for that suffix is just so that we could split the clinical variations codes that is safety related to then the safety changes and the safety changes gazetted fee from then the clinical codes, which is safety and efficacy, from then those types of variation changes linked into a different fee. As I said, the example below is just, where you see on the table the same variations code. Please then do check, as some of these are, the variation type is actually different. And that relates then to the risk profile. And then for, I think, some of the variations that is going to a very specific unit, you might also find then that even for those, we reflect them on the Excel sheet. But when you apply for the variation in the portal, you basically will just follow the workflow steps to say which variation type, which unit you're submitting to, so that internally we can then route it to quality, or we can route it to inspectorate, or names and scheduling, or clinical, for argument's sake. The next point that we just want to raise with everybody and bring your attention to is when you are selecting a code for related variations that you are submitting then as a group, please ensure that you pick the code that is linked to the correct variation type. So two things that's important. When you have related changes, you always then select the highest risk variation type. So when you start your process, you will indicate related change type 2. If your related change bundle comprises one type 2 and 3 type 1As and 1 type B, your highest risk is the type 2. Therefore, when you start your related change process, you will select related changes variation type 2. If you only have the 1B and the 1As, it'll be related changes 1B as the higher risk. I think, Madeleine, that's all on this slide that I wanted to highlight. Maybe we can just move through to the next one. Right. I think the thing around the submission matrix that we just again want to ask the industry members to please go and revisit the SAHPRA ECTD webpage, where we have published the matrix as well as the various submission types. I think the structured submissions change that we communicated March of last year, which we effectively then implemented 1st of November, provides very clear guidance around how those evaluation changes may be submitted, or what can be put into a submission. So where we have, for instance, and this is really important to understand because the engagement portal has been written and developed to support the 3.1 specification. And where we have indicated on the submission matrix, you have submissions or changes for argument's sake, a type 1A that must go to quality and must go to the inspectorate unit because each of them need to do some work on this particular change. The quality 1A must be in a submission because that submission gets routed to the quality unit within DocuBridge for processing and finalization. That same code that also then needs to go to the inspectorate unit must be in a separate submission and sequence so that that gets routed to the inspectorate unit for processing. Those are not to be combined in one submission because they need to go to a specific workflow unit for processing. Therefore, for those changes, which always is a two-stepper, where there's a quality component and inspectorate component, for the 1AIN, you will submit to the quality team their code with their particular change. And once you've received the approval, you will submit your inspectorate component to the inspectorate unit for the same code, same change, so that they can then process those changes sequentially. One of the key things for us there is to make sure that each unit, each work stream, gets adequate time under the 1AIN timeline to complete their review, complete the work, and then meet the required timelines. Because there is two sets of resources working on this, we also then need to do the resource management accordingly. And as I said, within DocuBridge, we have got the automated workflow routing that sends a particular activity down to a particular work stream to process. Madeleine is going to talk a little bit now around how content reuse fits into this. So I think we can probably come back to this. I think, Muddy, once we've covered all of the slides, this is particularly the instance where we are going to be dealing with content reuse, and Madeleine will take us through that. The other thing which we again just need to remind everybody of is that there is under 1A and 1AIN, we do allow for changes to be submitted as a group in one submission sequence. They may be related, they may be not related, but it's up to 3 evaluation changes or 3 codes per submission sequence. For 1Bs, 2 can be grouped in a submission sequence. They may be related, they may not be related. And then for type 2s, only 1 code or evaluation request per submission sequence. This we have captured in the ECTD 3.1 spec as well. This is the expectation, and this is also how we will be taking those in via the portal. For related changes, where you are having 1AIN, 1B, and type 2s, those related changes need to then be submitted through a related variations type submission. And please ensure that they are actually related changes and not a bundle or grouped number of changes that you wish to submit. We will be publishing in July the updated variations guideline, effective for implementation then 1 October. So 1 October, we will have the process in place where you will apply in advance for pre-approval of related change submissions as we move forward, where what it is that we want to change and how the relationship actually then exists between those changes gets captured on the portal. The unit then approves that, and that approved related change submission gets pre-created for you in your workflow, so that when you are ready to do your submission, we already have the detail and the information, and we are aligned in terms of, yes, this is related changes, and yes, we can process this under the related changes code. For related changes, there is no cap that is applied in terms of the number of 1As and 1AINs and 1Bs and 2s that you can combine in a submission. But the new guideline will be very clear around the timeline for related changes that will be extended to 220 workdays for processing. I think also the new guideline, what is important is, other than the pre-approvals process for related changes, we will also be introducing a submission window. And this is also something that will be managed through the portal, where your type 1Bs and your type 2s and your related changes will be received or taken in once a quarter in a specific submission window, where that calendar will be published for the year. And in those 10 business days that we open up per quarter, all of the submissions that you intend to submit for the 1Bs and the 2s and the related changes can come in. Once we close the submission window, the resources are then planned and deployed, and batch processing happens then for those changes for the particular quarter. There are some changes to the timelines for 1A and 1AIN, type 2s and the type 2s and the 1Bs that will also then be communicating in the updated variations guideline. And this is in line with the actual processing times that we've observed. And one of the things that we then have introduced is the concept of the submission window. So we can start creating some consistency around the turnaround for these particular submissions. As we know what's coming in, we can plan resources, we can reallocate or divert resources to process then what we have, what has come in order for us to consistently meet these adjusted timelines. For Z codes, and this is quite important, at the moment we have a process where you can apply for a Z code. Again, just according to 3.1, your Z codes need to be in a separate submission sequence. They cannot be combined even with your related change. So for Z codes, we are also from 1 October having a process where for a particular change that hasn't been captured on the variations code reference table, as you would normally do, you would send your request to SAHPRA for a particular change. The unit will then evaluate that. We will create a new code with then a linked variation type, link them to the appropriate timeline and the appropriate fee, and we will send you then the code, send you then the code that you are to use when you do that particular submission. So we will not have Z codes as a miscellaneous item from the 1st of October. You actually would do a Z code request, but receive back a definitive code. And on our side, what we then do is once that code gets created by the unit, that new code gets added onto the variations code reference table and will be there also for future use. Madeleine, I think that's it on this one. We can maybe go to the next one. And that is it. All right. Maria, I don't know if I can maybe then ask you just to talk a little bit about the content reuse and how this fits in with the, for instance, the quality inspectorate example. And if there's anything else that I might have missed that you also just wanted to touch on, I can hand over to you. Thank you.
Thank you, Kristalna. Good morning, everyone. Such a exciting time the portal go live and a lot of changes. I know it's a lot, but it's just actually making evaluation streamlines a lot easier at SAHPRA side. So I really want to talk first about content reuse. Let me just start with the submission type matrix. So as it currently is on the website is according to the current validation that's happening coming through the system. So currently there is still a bit of grouping going around and all of that. But come Monday, that submission type matrix is going to look different according to the current workflow as per the portal. Currently, why it's still reflecting as such is because it's still until 4 o'clock today, you can still submit your sequences as they are, right? And we could not change it because it's an active live validation criteria that's running. But come Monday, it's going to look according to what is the workflow at SAHPRA. So just to state that, then just on content reuse. So the moment when Spec 3.1 came out, there is this encouragement that we don't resubmit documents. And I actually want to just refer you to the validation criteria. There's actually one that says, let's just see, 4.5.10 will actually give you a warning in an ECTD that when you replace documents, they should not provide content identical to the previous file. So when the validation criteria is running, it's actually looking for that MD5 checksum of the document. Oh, this is the same document. I will give you a warning, right? And the comment is, when I'm replacing content, the new content should be different from previous content if a physical file is being provided. Okay, so now, oh wow, it feels like we are a bit stuck in a conundrum because now I have to submit to quality. And there's a document that inspectorate also needs to look at when I'm submitting the same variation to the inspectorate unit. So that is where content reuse was written into the specification 3.1. Yes, this is a very technical file, and I would like you to encourage you to go to your software provider and ask them, how do we do content reuse in our specific system? Sorry. Basically, what is happening is that I can literally, with the XML backbone of an ECTD, refer to a document instead of having the document again in the sequence. For instance, if we look at, we reuse files in the same sequence, is that when I have the sequence, and I have, for instance, a literature reference that is in 4.3 and in 5.3, I can actually just reference the one instead of putting the document in twice. We are encouraging it because if we just keep on continuing having the same document over and over and over again, we will get into a place where our server gets full, and just having a copy of a copy of a copy is just really just mundane. So content reuse is actually very forward thinking. It's actually very encouraged with when we go to the ICH spec 4.0, where content reuse is really a big thing. So at this point, it's a warning. When we get to 2030, it's going to be an error. You cannot submit a document twice. It's also better for versioning of your documents in your own document management system. So please, I would really encourage you to reach out to your software vendor. How do we do this? Okay. So, and then we have the situation where we're asking to do content reuse that has already been submitted in a sequence, right? And then there is actually one day I want to actually do it when it's submitted in another ECDD application. And that's why it's important to have the correct application ID. So basically what it is if we go to the technical part, it's actually looking for a link. I'm linking actually to that document, right? And this is just in the same sequence. And if we go a bit down, if it's in, I want it it's in sequence 2, but I want it in sequence 1. It's actually, you will see this example is the backbone of sequence 2, and I'm referring to the document in sequence 1, right? I would say it's kind of a hyperlink in the backbone, but really not. It's an actual link that's telling it and directing you to that document in a previous sequence. How does it look like in your system? I cannot tell you. I can tell you from our software, but from another software, I am unable to assist you. You have to reach out. How does it work in your software system? Right. And if we look at something that is in a different application, you will see that the link adds that I'm looking for that. That is now the application ID, that is the sequence, and what document I'm looking at, right? It's very important that, remember, there's a big thing that happened the last few weeks is that it's saying you cannot replace a document because a cross-node operation exists or some of that. When we look at what is in SAHPRA system and what is at applicant side, there's some MD5 checksums that differ. That means sometimes some sequences were republished somehow. If you republish a sequence, your leaf ID will differ. You won't be able to use this content reuse. You won't be able to do a lifecycle operation because you republish something. So just be aware of it. Please do not republish sequences on your side if you have submitted it to SAHPRA. So basically, it is actually linking to the document when we're doing content reuse without supplying the document again. So in your sequence, it will look like, oh, okay, this document is again in the sequence for an evaluator, but in reality, it's in a previous sequence and the document is stored in that folder at the back end. So if you please have any questions on this, encouraging you again, please reach out to your software vendor to explain to you how does it look in your system. Thank you, Kristalna.
Thanks, Madeleine. So, I mean, I think hopefully we are clear around submissions coming in. If you are submitting for a code change to quality and you have to submit that code change to inspectorate, it's 2 submission sequences. And obviously, because we've got 2 different work streams, work stream quality processes the review, they approve it before even inspectorate would look at that. Therefore, it is then logically grouped in our system at the moment so that quality changes comes in, it gets processed, it gets routed to the unit. Once you have received your approval, you will then proceed to do that submission for the inspected component so that the next team that is then responsible, that will also then rely on the internal decision from the quality unit, can then go about their business and process that. So 2 different submission sequences, 2 different order numbers, 2 different payment sections to be processed. I think the other component is just, as I said again, just to re-emphasize, some of the information that's required for the trigger file. Those information attributes will then be locked for further changes. However, if you still have any of those attributes that needs to be corrected, you need to then send the email through to ectd.validations@sahpra.org.za for the colleagues then to manually update those attributes first through DocuBridge and that then to be resynchronized automatically back to portal. It is time-consuming process as we have to now work through 2 different work teams to get that done. And that's why the turnaround time for those ones will then be an extended 10 business days to process. It's not to say that we cannot change these things post this afternoon. It is just that there is not an ability for you to do those changes now because it will then constantly require us to have admin freezes and resynchronization of databases. We have to manage that through a proper change process. I'm not sure. I'm just trying to think, Madeleine, if there's anything. So not particularly in terms of just highlighting then these particular points and making sure that we've got very clear understanding and that we are then also from Monday activating both variations as well as then the renewal submissions via the portal component. Comment miskien that I can just chuck in there is just around the variations code table. It is an Excel table. We will publish that also on the webinar after today's session. So you would be able to download that and then also have a look at that. On the variations code table, it will be an appendix to also our new guideline. And we will also then publish that on the ECTD webpage because it will be a living table, a living document. And we will continuously, as we create new codes and new Z codes, requests have come through, we will continuously be updating that table. And at the same time, those additions and changes will also reflect in real time in the portal so that we continuously keep the master data aligned. Once it's available for you on the portal and you can use it. So I think probably those were maybe then the main things that I just wanted to again re-emphasize. Great. And I think Monday then that basically covers everything that we wanted to share. I will just encourage colleagues that are having challenges with their ECTD validations. Please, you need to contact your ECTD software vendor for assistance on validation errors. I think by and large types of inquiries that we are seeing are things that the software vendors could assist you with. And if you still are unclear around the 3.1, you are also welcome to then reach out to Madeleine and the team at Victor for further clarity, or even if you want to arrange training with them. that I suppose could also be done if there is a need from your side for to be done. And that I think covers the comms for today. I would like to thank everybody for joining the session. Tukozo will assist us with just getting the recording out within the next day or two. And then we will then, as I said, at the same time also push out that Excel table. So hopefully we can get all of this out to you by Friday afternoon so that come Monday you can refer back to the recording and obviously also to the Excel sheet for further guidance. Thanks very much for joining, everybody. Greatly appreciate it. Thanks, Ntukozo. I think we can close off the session.
Yes, we can. Thanks, Kristalna. Bye, everyone.
Thank you. Bye-bye.